Hello everybody. We're finally getting into the meat of what we'll be working on this semester, needs assessments. Um, just want to remind you that this is largely coming right out of the textbook. I have augmented some of the information to give you some more illustrations and some added information as well about asset mapping that's not found in your textbook, so hopefully you find that helpful as well. So before we get really focused on needs assessment, I want you to watch this brief video. It's only about 5 minutes long, but it sets the stage for a conversation not just on needs, but the importance of capturing and understanding the assets of a given community. So take 5 minutes and watch this, please, before you get into the rest of the lecture. Okay, so as is indicated in the video you just watched, assessment of needs can be entirely too deficit-based. We often think of what a community is missing rather than what the community has capacity already for, or capacities in which we can build upon. Like the video suggests, when we think of only the deficits, we lose sight of the human potential and the other potentials of a community, and we actually hamper communities by doing so. We don't engage and help them to sustain their own efforts. In fact, sometimes we arguably cripple communities by our work if we come in and bring in outside supports that are not sustained past a grant or sustained in terms of capacity in brick and mortar or in human resources. So please be mindful as we're talking about needs assessment, although it doesn't necessarily apply to what we're doing in class this semester, it certainly does when you're working in a community. Focusing from a community-based or arguably a strengths-based perspective of community members really changes your perspective on the programming that you'll put in place. So review that video as often as you need to. I think it's a really short and wonderful reminder of what our jobs really should look like. Facilitators more than saviors. So let's talk about needs and needs assessment. Of course, we start with definitions. Again, this is right out of your text, so please feel free to refer back to that if you need to, or reach out to me with any questions. So a need in itself is just the difference between the present situation and a more desirable one. I find myself clarifying with my children oftentimes the difference between a need and a want. A need is something that is truly something that you can't live without or is otherwise impairing your existence. And a perceived need or a reported need, as talked about here, counts as the same. If a community perceives a need, it's a valid one. Important to remember, we might not as outsiders perceive the same needs if we do our own assessments, but listening to what someone is actually telling you is a need is good enough. So a needs assessment then is the process of identifying, analyzing, and prioritizing needs of a priority population, doing some diagnostics and assessments, and hopefully feeding all the information right back to the community itself and informing program planning as a result. It's always a good first step in the process, especially if you are working with a new community or a community has reached out to you for help. So there's a lot of different reasons why we should do needs assessments. Really, the information that we gather should be the evidence or justification for program planning, as opposed to us coming in and saying, this is what you need. A needs assessment is telling you what the community is perceiving to be needed for them, for the community that they envision or want to see. So it's certainly a logical first place to start. It helps you to understand the resources and for the communities to understand and really articulate the resources that they have. Doing a needs assessment helps communities prioritize what they want to work on first. Many different reasons. There's a list here. We could probably go on, but it really does give us, hopefully, an overall picture of not just what the needs are, but what the assets are that go along with those needs and the capacity of the community. So there's a reason why we're hearing more and more about needs assessments. There's two specific reasons why, one of which is that now, in order for public health departments to be accredited, which is important, governmental public health departments, needs assessments are now required. So that's why we're going to hear and continue to hear more and more about this. The other is that under the ACA, in order for organizations to keep their 501c3 title, so their nonprofit status. They are required to conduct community health needs assessments and adopt those strategies based on the needs assessments every 3 years. So this is something that is built into the system, so to speak, now, in an effort largely to ground people in the needs of the community rather than just working on what the organizations themselves feel to be the priorities. So now that we've talked a little bit about some of the reasons why we're seeing this more and more and why this is something you'll likely be part of down the road when you graduate, is to really understand the basic definition of a needs assessment. So we clarify what a need is, and a need assessment takes it one step further. We are not only collecting information to analyze the issues, resources, constraints, priorities of the population, we're also then building off of those prioritized needs and the resources to develop appropriate programming. So these are two definitions that are coming out of the text. There were more that were offered up, but these two I think better capture what a needs assessment really is doing. So again, it's not just assessing the needs, it's then helping to use that information to better define appropriate programming as a result. So a needs assessment should answer these 9 questions. I'm sure we can come up with more, but these again are out of the textbook, and I think they give a pretty well-rounded idea of what the task of a needs assessment really is. So we have to first ask ourselves, who is the priority population? What are the needs of the priority population? Why do the needs exist? So like we talked about in class the other day, it's not important to only understand what the needs are, but to understand the context in which those needs have arisen in the community, what creates those and determines those needs, subgroups of that population who might be in greatest need. So if you're looking at a broader community, there are likely subgroups who are more vulnerable or otherwise more disproportionately affected by a particular need. What are these subgroups located, or where are they located geographically? So understanding where people are in the community, quite literally. Resources are available to address the needs, right? So if you look at these last 3, not only looking at the resources, right, what's already been done to address these needs, and what is currently in action. Most communities, when there is an understood need in the community, there are efforts already in place. So a needs assessment might highlight not only those needs, but also what's currently happening. These 3 last bullets here really do get at what are the assets of the community? What strengths do they have that can be built upon when thinking not only through the needs that are articulated, but the programming we want to do next? So I'm going to jump into acquiring data, which is where we're going to be focusing on in class the next couple of sessions. So there's 2 primary types of data when we're talking about a needs assessment, both primary and secondary. Primary is what it sounds like. So it's data collected that's unique to this particular effort, and it's acquired through active collection of data. So there's advantages and disadvantages, as you might imagine. Obviously, we can get direct answers to the questions of the planners, hopefully by the planning committee, which includes consumers. But the disadvantage is that it takes a whole lot more time. Secondary data is what it sounds like in terms of any kind of research, in that this is already existing data that we can gather maybe from national or community level, hopefully community level, data reservoirs, essentially. So there's big risk assessment, surveillance that happens amongst many different communities and states across the United States. So there's benefits to this, right? It already exists. You don't have to collect it yourself. The disadvantage is that it might not identify the true need in a priority population. It will depend on the questions that were asked in gathering that data. So much like in any research capacity, primary data, you are the one, and again, you being hopefully a collective of representative folks, are the ones who are asking what questions are necessary for that particular community and the information you're hoping to seek. Secondary data, much like in any other situation, you can certainly glean a lot of information from those data sets, but you are not directing the questions that were asked, so you thereby are already limited by what was done versus what you can do. So, sources of primary data, single step or cross-sectional surveys, so this is very much like what we've been talking about, often referred to as self-report measures in any other research capacity. What we are doing essentially, although we're not naming it as such because it's a class activity that we'll be doing, is gathering self-report measures by and large. And obviously we'll be using other resources for varying degrees of needs assessment within the community and asset assessment. But self-report is the most commonly used, and it looks often like written questionnaires and surveys, face-to-face interviews, telephone interviews, group interviews, electronic interviews. There's a theme, right? One-on-one or group and facilitator meetings to gather this. So before we go further, if this is the primary kind of data collection for a needs assessment, or again in any other research capacity, ask yourself this question: what are the limitations of self-report measures? Right? So although this is scripted in terms of what is often used for data collection for needs assessment, I think it's important to go into it fully aware of what the limitations of this primary method are. So think about that yourself and then move on to the next slide. So in some instances, I want to just point out, and the book talks about this very briefly, we can't access the priority population members directly. This might be because we're trying to talk to or understand the needs for infants in a particular community, or maybe a group of individuals who may have compromised cognitive abilities. The book talked briefly about those with dementia. So then in this case, if we're looking for primary data collection, primary would then be a proxy measure. So using a group or individuals who could inform us of the needs of that population. So this could include significant others. I think about this in terms of caregivers of those who are living with dementia, or caregivers of those of infants who can't speak for themselves just yet. You can also look to opinion leaders, so political figures, administrators of maybe school districts, or those who are otherwise very much boots on the ground and aware of the population directly. So you can access information through those individuals, or key informants. This is usually done and has been done in other research capacities, again, where you ask for in-depth information from someone who has experienced this. So it can be more of a in-depth interview, so to speak. The difficulty with key informant interviews is that it's really explicating one person's experience. So it may not be representative of everybody else who is in the same situation. So the needs might not be as clearly spelled out or as broad if we're only honing in on key informants. So useful information to have, and important to recognize the limitations of using any one of these. There's also another option of primary data collection, multi-step, or a Delphi technique. This is something that you may have already experienced in telephone calls to you, but this is kind of a series of different ways of collecting data, so that you take an initial set of individuals, you interview them via phone or email or what have you, and based on that priority population, that small sample, is then when you define the greater survey or assessment tool for the greater population of folks that you're trying to get at. So it begins by asking priority population a little subset, 2 broad questions or 3 broad questions, and then using that information to further define and hone in on what would be asked next in a broader reaching and more specific survey of the population you're interested in. So ideally there's a consensus that happens in these answers. Sometimes it can get a little tricky when you have very distinct themes popping up when asking these 2 or 3 broad questions. So ideally consensus is reached and you can move forward around those particular agreed upon areas in the community. So there's also other avenues of collecting information and primary data for your needs assessment. Community forums or a town hall meeting. This question was asked in class last week, and this, I think, spells it out better than I did. So the main purpose of a community forum is really to inform the public, but in informing them, often discussions can arise that will inform the direction you need to go in or the topic areas you need to focus on. So the process by which a community forum works is you have a moderator who explains the purpose and the tasks. Recorders are present, and so you either digitally recorded or copious notes are taken, whichever people are agreeable to. There's ground rules so that people are not just coming in and speaking all over each other. So oftentimes there's someone somewhat policing how much time anybody gets of the floor. Questions are certainly permitted, like I said before, and it's always important to think when you have a group setting of any capacity that there might be a group of folks or individuals who are silenced by the group, who don't feel comfortable enough to speak out. So you might be missing some of those needs because of the group dynamic. Other meetings, so town halls can also look a little different in that you are gathering information from the priority population. So it's almost like where you're starting off. This goes back to the idea of the Delphi technique. You can meet with a group of folks who then give you a broad umbrella of what they perceive to be the needs as members of the community that you're working with. And then you hone in on specific themes based on that initial meeting. So again, like the community forums, you have to be cognizant of the fact that not everybody will speak up. You'll get certain information based on only the people who show, and that in particular communities may be a bit deceiving. Those who have time and energy and resources enough to be at your meeting, are those the very people that you need to be talking to, or are they missing maybe, or would you be missing some of the information from the folks who don't have the time, energy, money, resources, access to the meeting itself? It's a very cost-effective way to gather information. You don't usually have to do much besides gather and maybe provide some snacks, but there are limitations to that as well. This is the last piece of this warning, and like we said before, although we might be missing information from certain groups of folks, it's also important to recognize that even those who speak up, there's this idea of social desirability, or in this case they're wording it social acceptability, so that people will want to look or be looked upon favorably by the committee members, oftentimes who are there, or the other town hall citizens who are there. So it's important to think about how cleaned up the answers might be versus the soft and vulnerable underbelly of what's really happening. So again, these are all wonderful tools, but it's also important to understand some of the limitations of any of the methodology. Focus group is a smaller setting, a bit more structured. So this is often used, as you all know, in qualitative research, and this is really information gathering and not just about data, so to speak, but also the feelings, opinions, beliefs. You can kind of test out new ideas or questions to see if they stick or if they don't in this group. So if you come in based on the literature or based on previous experiences and you think that you see a need, this could be a sounding board to see if that need really exists amongst the people who are in the community who participate. So a focus group is a much smaller circle. 8 to 12 is the rule of thumb. I usually say even 10 or less. It's hard to have everybody have a voice in spaces of groups larger than 10. So you'd have a small group gathering that is ideally members of the priority population, but maybe not entirely representative. Again, you're going to get who you can get. You don't have control over that. People should not know each other, which can be difficult depending on the size of the community that you're working within. But ideally, they're coming from different aspects of the same community. Led by a skilled moderator. There's a skill set used in running a group, and facilitating a group, and making sure that no one is silenced in the group. So it's best if you have someone who has experience in doing that, and or this is their living in moderating. Just be mindful of the cost. So the moderator then takes the whole group through unstructured interview questions. They're predetermined, but they're left fairly open to give plenty of wiggle room for the conversation to go where it needs to go. So I think of a series of umbrella questions. Observers are either taking notes or recording this otherwise. And the findings are then condensed and are used as suggestions on how to move forward, not as total fact, right? This is a conglomeration of opinions, beliefs, conceptions, misconceptions, and therefore, so again, this is a springboard for more information, not the end-all be-all. Nominal groups have a slightly different feel. So this is a smaller group yet, so 5 to 7 people. Everybody's writing an answer to a single question, and then you go around and share that answer with the group in a round-robin fashion. And it helps to stimulate conversation and and can be used oftentimes in helping to prioritize the needs if you already have information that people are responding to. So it's highly structured compared to the other methods that we talked about. And you're trying to get knowledgeable, small group of people who are representative of the priority population all in one place so that you can quantify the qualified information. So again, rank ordering and prioritizing, this is a very useful tool in primary data collection. Other options include observations. If you aren't noticing a trend here, these things are very much used in other research capacities. This is just how they are wielded in a needs assessment capacity. So there's different ways to observe. You can be direct or indirect, meaning it can be something that you're really concretely observing, like a particular situation or behavior, or it can be an indirect measure or observation of something that is indicative of something else. It can be obtrusive or unobtrusive, so the observers can be aware or they can be unaware of the observation. There's a couple different methods that are often used. The windshield tours is one of them. So windshield tour or walkthrough are similar ideas, just one's in a car and one's on your feet. This has been done, I know, on many different occasions, in various communities. So some communities are really concerned about the walkability of a community, but it's amazing what you can learn simply by walking through a community, especially one that's not your own. Oftentimes we're busy getting from A to B, but if you're walking through a particular neighborhood of which you are trying to assess the needs of, you might be able to see some on your own just by looking around. What are the condition of the sidewalks? Are there streetlights? Are there trash receptacles? Are there a number of boarded up or otherwise abandoned homes? Or is the reverse true? Are there lots of people out on their porches in community settings who are hanging out? Are there community gardens? Are the sidewalks well maintained? Are there streetlights? Are there benches or other places for communities to gather? So when you're doing an observation technique or engaging in one for primary data collection for a needs assessment, it's important to, again, not just look at the needs, but look at the assets that are there that you can then build upon with the coalition that you formed to do this needs assessment. Another form of observation is photo voice, which some of you have heard me speak about before because I'm hopefully in the works of getting one project off the ground in photo voice. So this is where you ask community members to kind of do something similar to what I just described in terms of the windshield or the walkthrough, but you're giving them cameras and you're asking them to pick up and document their own experiences in their communities. So you're enabling folks in the community to record or reflect on their strengths and their concerns in hopes that you can have a critical dialogue based on that information that's collected. So the pictures and then the reflection on those images that they're collecting, those photos, that gives voice, get it, photo voice, to the needs and concerns that they have in their community. And one of the main objectives of photo voice is that it's not just an activity within the community, but then the same information is publicly shared, particularly with policymakers, because it gives policy makers and legislators a very clear and humanized version of what the needs are and the perceptions and reflections and assets of that community are as well. So there's lots more information out there on photo voice if you're so inclined to look at it. I certainly have a lot if you want to come pick my brain about it or any of the papers that I have. So lastly, around primary data are self-assessments. So this is what a community can do on its own really without anybody else. This is a personal review procedure as they're talking about it in the book. And really focuses on primary and secondary prevention issues, so not tertiary, not strictly reactionary, and is completed solely by individuals in the priority population, with or without assistance from any of us. And it can take the shape of health risk assessments, health status assessments, or self-screenings, like literally checking your body for moles that might look funny, breast screenings, testicular screenings, you name it. One of the most commons are these health risk appraisals. So these are often incorporated but don't have to be in the needs assessment process. And the health risk appraisal is really to determine the odds of a person with particular characteristics to die of a particular cause within a given time span. So planners have those in the priority population complete a particular questionnaire. That questionnaire includes questions about health behaviors, personal family history of a disease, demographics, and some physiological data if available. So planners can use these individual reports and aggregate them to use for either health promotion, health education efforts. Again, it's a wonderful way of primary data collection that can inform the individual who's actually performing it as they're doing it. Doesn't have to wait or depend upon a program put in place, but it can also be used to inform the program planners, hopefully again the committee that's doing this, about what needs to happen next. So before we go on to anything else, I want you to just stop and ask yourself a question related to our class project. So reflecting on the different areas or methods of primary data collection that we just talked about, which of them, and it can be more than one, would you use in our class project and why? This will help you think through your homework assignment and hopefully help us as a class altogether to move forward. So secondary sources of data. I'm going to try and move through these a bit quicker, and then we'll take a little break and have another video. So secondary sources of data are numerous. They can be data collected from government agencies like the CDC or Census Bureau. These things are collected by law. Others are collected voluntarily. They are state and local, they're national data sets. These are big data. Epidemiologists usually salivate over this stuff. It certainly can be used to inform efforts for a needs assessment as well. Again, I think about the needs assessment being really quite specific to a community, but it's always in the context of a larger community or the state itself, and then certainly within the nation. So important to think about the various systems at play. Data can also come from non-governmental agencies or organizations. Healthcare systems are a really good source of data related to particular health outcomes. Voluntary health agencies, there are a host of them. Civic or commerce groups also sometimes have data that would be useful. And local agencies and organizations who collect data. For instance, Planned Parenthood has quite a large data set on STI rates in various communities. Could be a wonderfully helpful data set to look at if, in fact, that is something that pertains to a needs assessment you are conducting. Data from existing records has pros and cons, much like primary resource or data can as well. So existing data, like I mentioned before, can be low cost, really don't need anybody to staff it to do it because it's already put together for you. And you often can get a much larger sample size because there have been funds poured into collecting that data before you. The disadvantage is that you have to gain access to those particular records, which sometimes can be challenging if it's not already aggregated by a larger body and or de-identified and aggregated. You can run into issues around HIPAA, right? So protecting individuals' health information. And again, like I mentioned when we first started this whole gathering together today, that existing records are helpful, but you aren't the ones who are dictating which questions are asked, so you only have what answers are available. Data from literature is also important. You can certainly look to see who's published on what else has been done in these areas. Are there similar populations and communities that you can learn from others' experiences in defining needs and programs? There's a couple of different databases that we have access to here at school that are very, very helpful, and I highly recommend you visit when putting together future assignments. So we're going to take a little break and come back to this one.